Health practitioners in Nigeria seeking to relocate to the United Kingdom may have to seek alternative options as active recruitment by health and social care employers has now been put on hold. The announcement was contained in the revised Code of Practice for the international recruitment of health and social care personnel in England. This follows a report by the World Health Organization, WHO, that some countries are facing the most pressing health workforce challenges related to universal health coverage. News Centre's Adesewa Odusoga reports.
There are about 11,000 Nigerian-trained doctors working in the United Kingdom, with more still willing to leave. Nigeria has been faced with a worrying brain drain in recent times, with many medical practitioners leaving the country for greener pastures. After India and Pakistan, Nigeria has the third highest number of foreign doctors working in the UK. The United Kingdom has now placed Nigeria on the red list of countries that should not be actively targeted for recruitment by its health and social care employers.
Yeah, that news really didn't come as a shock. I don't think it came as a shock to a lot of healthcare practitioners in Nigeria, because we've always been saying that there is shortage of healthcare workers, clinicians in Nigeria healthcare sector. The country is in a terrible state. The investment in the healthcare sector is abysmal. It's tragic, right? So you don't expect doctors to thrive in this kind of condition.
Similarly, lawmakers in Nigeria also proposed a bill seeking to curtail the mass exodus of medical practitioners, where qualified doctors would only be granted full licenses after they had worked for a minimum of 5 years in the country.
Anybody who wants to leave before 5 years, he should refund the government of Nigeria the money that was used in training him.
Very depressing, right? It's very annoying that policymakers, instead of looking for ways to improve the healthcare sector, for example, increase the annual budget of health. There are other ways you can tackle this problem. Why are these people leaving, first of all? Why do they intend to leave? They don't feel safe. They don't feel well compensated. Sort that out. Fix that.
In a related development, the Vice President of Zimbabwe has also announced that the country intends to introduce a law that will make it illegal for other nations to recruit its health workers.
Good remuneration, you will see these workers not going out. Unfortunately, this is not the case in Zimbabwe. We cannot rely on putting laws to say we would not allow you to go out because you are destroying the system. No.
Although the United Kingdom has stated that the policy does not prevent individual health and social care personnel resident in countries on the list from making a direct application, but in-house policies in countries like Nigeria and Zimbabwe may make the relocation process even more difficult for intending medical personnel. Adesewa Odusoga reporting for News Central.